Welcome. You're tuned into Life is a Sacred Journey. Every week, we bring a new perspective to aging and caregiving. Here is your host, Michelle Pope.
Good morning, good afternoon, and good evening to all of you in the virtual neighborhood of Life is a Sacred Journey. I have Dr. Pearl in the waiting room, and I wanted to start a couple of minutes early this morning because I wanted to reach out to the Life is a Sacred Journey family and let you know that one of our dear family members, Bettye Smallwood Kray, passed away. And it was surprising to me, to many of us. She was just with us on Life is a Sacred Journey last week. She sent me a direct message to, just say how much she enjoys the podcast and how much she wants to continue to support me. A United Methodist woman, a woman that had a voice that she used to sing with the interfaith choir. Just somebody who has touched us all, and all of you who come to Life is a Sacred Journey, you have shared the chat area with her. So I just wanted to come on and just say how much she meant to me. Just a wonderful, wonderful person on the planet. I just lit a candle, or we have the ever burning candle over there for everyone that has gone before us. But I just wanted to take time, that we should give people their flowers when they're with us, but sometimes they leave before we can. And so I just wanted to give Bettye her flowers. So if there's any of you that are followers of Life is a Sacred Journey and Miss Bettye, just write something in the chat this morning just to let everybody know how maybe you met her, what your interactions were with her, and how honored you were to walk with her on this journey that we call life. So good morning, good afternoon, wherever you are, good evening, and welcome to Life is a Sacred Journey. It is my honor, and I'm going to bring him in now. There he is. There
I am. Good morning. How are you today?
I am wonderful. I am just so excited to be back in space with you. I've missed you, and we've both been really busy over the last couple of years, but it's really good to be back with you in this virtual space. So I hope you're well.
I'm doing really well. I also missed having dinner with you. Our last show, you may remember, had 1 million TikTok viewers on it, which was a remarkable accomplishment. I was so excited. Today will be just as interesting.
It is. I'm going to remind everybody that's out there who you are. Dr. Robert Pearl is the former CEO of the Permanente Medical Group, named one of the modern healthcare's 50 most influential physician leaders. Dr. Pearl is a professor at Stanford University School of Medicine and the Stanford Graduate School of Business. He is the author of the Washington Post bestseller, Mistreated, host of the Fixing Healthcare podcast, which you can go and listen to. It's fantastic. And a regular contributor to Forbes. He also has his own newsletter. And the last time he and I were together with you, we were talking about uncaring. And then a group of us here at ASAB did it as a book study. And it was a remarkable book study where we began to look at ASAB, even within our small space, and how we're not only treating our multidisciplinary team, but also how we're treating each other as a team so that we could provide better care because we were healthy and we were spiritually intact and all of those things. And Dr. Pearl raised that issue up back before the pandemic. And the reality is, the pandemic now gave us the pow, pow, pow punch and really said to some people, you need to wake up. You haven't been paying attention to this. And now we hear about striking in my home state, New York City, and all places all over the continent. So Dr. Robert Pearl, you are a dear friend in my heart. I carry and have carried you throughout the time of the pandemic. And I'm so happy that you are here. And I have a lot of questions about this pandemic. And the first one is, in these moments when I'm getting back out into the world, as people say, that's the new coin sort of phrase, back out into the world, I'm noticing that even in crowded spaces, even though we know that we can still contract and pass multiple level or different types of COVID or different types of disease, people are not wearing masks. And then you'll hear later on, little by little, the people that were at that conference are sick with COVID or strep throat and COVID or COVID, strep throat, flu. I just came back from Salt Lake City not too long ago, and that's exactly what happened. I threw because I'm boosted and I wore my mask the entire time in those spaces. Didn't get it. I have had it. The COVID finally got me, as they say, but it took a while because I was vaccinated. But can you help us to understand, are we in a pandemic still, or are we out of the pandemic?
Well, it's interesting. We're actually right now in a triple-demic, believe it or not, because it's a massive viral season. So COVID is unique in a couple of ways. First, the new variants are very transmissible. And number two, for people who are at risk, it's significantly more dangerous. So typically a year, maybe 40, 50,000 people die from flu. The rate we're at, COVID will be 2 times that or even slightly more. But it's not affecting everyone equally. If you are older, over the age of, pick your number, 65, 70, 75, if you have multiple chronic diseases, if you're taking medication for a transplant, you're at great risk and your chances of dying are significant. The other people, far less so. I don't want to say it's zero because it's not zero, but it's far less so. And what you're really talking about is our mind. How do we see risk? How much risk do we want to take? For what reason? You drive on a highway in the rain, it's a certain risk. You want to go where you want to go, it's advantageous. So, people in other countries, particularly Asian countries, often wear masks to protect themselves from lots of viruses. It's culturally what they do. Mm-hmm. And in American society, masks are the bad guys. That's who has to put on masks. What are you hiding? What's going on? It's just cultural. It's not logical. Yeah. Logically, it's what you say. We wear masks when the risks go up in the winter, when we're in crowded areas, when we go to conferences. But we don't like to. I like to see your face. I like to see your smile. I like to see your expression. That's very American. So all I can say as a physician is if you're at high risk, you should be wearing a mask, not just against COVID, but also against the other 2 viruses out there in the triple-demic, the flu virus and the RSV, the respiratory syncytial virus. And as you say, there's lots of other ones. I have a friend who has a 7-year-old child. He took his daughter to the pediatrician the other day. Pediatrician said, your daughter's going to be sick until March. Not because of his daughter, because that's the viruses that are around us right now, because we haven't had them for 2 years. And our immunity is less than otherwise would have been. So that's what I want to say to listeners. If you're at risk, please mask up. If you're not, you got a choice.
Yeah. Well, and the other thing is this, our immune systems are varied. That's the one thing that I really have studied and tried to figure out. My brother passed away in 2021 and he got hit by COVID in the hospital and just never came out. But he went in for something totally different. And what I realized is because his immune system was compromised at that time, he was already sick. By getting COVID on top of it, even though he recovered from it, it compromised his heart and his health. So this conversation around COVID and vaccines and the heart, because there's a lot saying, okay, people are having more heart attacks now because they've gotten the vaccine, the boosters, and all of this. Is there really good research that says that there is a possibility of these vaccines affecting our hearts?
So first of all, let me back up a tiny bit for listeners so they're clear.
Yeah, please. Yeah.
There's viruses and there are bacteria. Bacteria is strep, staph. There's a whole range of them. Bacteria can be treated with antibiotics. Viruses can't be. Viruses depend upon our body's ability to generate an immune response. Now, if you have bad immune response, bacteria can be problematic too, but we have more aggressive treatments. Viruses, we have almost none that are particularly effective. So that's why someone like your brother, and I'm sorry for your loss,
thank you,
didn't have the immunity. That's why I was saying people with chronic diseases, people on medication, they are at risk because the one weapon they depend upon, their body's response, is impaired. Vaccines increase that ability, but if you're compromised, the vaccines are not quite as effectively. So the question you're posing is some of the discussion that's been happening around vaccines and what's called myocarditis. So it's not a heart attack. A heart attack is when the blood vessel to the heart is blocked. It's actually an inflammation of the muscle of the heart. It happens in a lot of different reasons. And actually viruses, including COVID, cause it because the heart muscle can get infected from the virus just as much as any other place, just as much as the lungs, let's say, in COVID. And the data says that with one of the vaccines in mainly boys who are mainly young, there's an added risk, which, by the way, is still very small.
Small.
And actually, if you're going to get COVID, the risk of getting myocarditis from COVID appears to be greater than the vaccine. But for most people, we're talking about the risks of 1 in, 100,000. I mean, really, it's so rare, it's not worth worrying about. Every piece of data that I have seen has said vaccines are safer than non-vaccines.
Okay.
Exactly what they do, how much protection they give. Does it protect you from getting sick or only from severe disease? This is being debated all the time and changes as these new mutants come along. And I think the conclusion is the vaccines still are very effective against hospitalization and death.
Yes.
All right. Whether they're effective against getting sick or not. So in some ways, COVID for, I'll call them young, healthy people, it's just another virus. You could get the flu, you could get COVID, you get RSV. For the people who are at risk, COVID has a lot higher danger. Get vaccinated, get boosted, wear your mask, because you are at risk at it, because it's so contagious, as you say. You go to a meeting, and a third of the people who leave there are sick. Yeah. It's not 1 or 2, it's a third of the people who are there because the virus can break through infection and break through immunity.
And because when we I love that you talked about societal, because we as a society, because we said, let's have our conference, we let our guards down because we saw our friends that we hadn't seen forever because they're in the field and you want to reach out and hug them and you pulled and your mask was down here instead of up here and all these little things. And we began, even in that environment, because we were there for 6, 7 days. And within 48 hours, people started getting sick. And right there, one man had to be rushed to the hospital. Another person had to be in their room. It was amazing. And I watched this sort of like at a concert, the wave, where it's like, and you could tell what you're saying is so right on. And this is not a ding at those individuals, but they had other things going on as well. Health issues. They were older people. And then the rest of us who got it after the fact, not myself, I had it before that. We just got it because we were they just got it because they were in a space where everybody was getting it at that point because nobody was wearing their mask. It was really amazing to me in such close quarters. We were so very close to each other. So the other question around this is we still are finding that people of color are still not vaccinated at the level that other ethnicities, cultures are. And we know that that was the beginning of the pandemic, where there were waves of people of color who were getting sick, older people, high blood pressure, all those kinds of things. What type of education, because in your books, you're really good at educating and breaking it down and lay common language so that people can understand and embrace maybe a new idea to follow. How can we begin to take down some of the systemic barriers that created this, but also to move forward in educating people in a very different way so they can take better care of themselves.
There are two parts to the question that you're raising. And the first one is, how do we help people to become better educated as individuals? But I also think there is a reality of racism in medicine. And as healthcare providers, we have not yet addressed it. I talk about it in my book on Kray, the one you mentioned earlier, by the way, all the profits going for Doctors Without Borders. All right. There's a lot of data. A study just came out. This was an NIH study. It's funded by the government. So all the people have coverage. All the arguments that say people don't have insurance or good insurance, everyone's covered. It's covered by the government. And this is looking at people who have significant heart problems and whether they get recommended to have a defibrillator, a very expensive device, inserted or not. And guess what? Black patients were recommended half as often as objective data would say. I mean, every excuse isn't in place except for, I'll call it biases, and we talked about this extensively before. So I don't want to tell people of color, it's your problem, because it is your problem, but it's also society's problem, and we have to balance both of them. And so I think what you're really saying is, how do we help people who have a reason to be skeptical?
Yes.
To overcome that skepticism. It's not a lack of education. It's a reality of their experience that they don't trust. And there's a lot of reasons when you have a new vaccine, an unknown disease, people dying, why distrust would go up. And you start with high distrust because that's the reality.
Yes.
Objectively measured, scientifically proven, and you change it.
Yep.
And so I'm going to offer two thoughts. First, for the individual, you still need to take care of yourself. And what we know is that certain actions, like getting vaccinated, will protect you. And I'm sorry for the people who are anti-vaxxers and deniers. The data is clear. The science is clear. We also know that chronic disease contributes to higher risk. So if you have diabetes, if you have high blood pressure, if you have asthma, if you have a lot of diseases, and we know that those diseases are more common in people of color. We can talk about all the reasons why, and it's in the book, about all the systemic and medical reasons why. And we also know that when it comes to these viruses, almost all of them get transmitted through the air. And in general, people of color work jobs that put them in contact more often. Take public, in New York, go on the subway. All it takes is one person in that car. But if you don't have any other way to get to work, you got to support your family. What choice do you have? That's right. So I want to have people be able to see the reality and get past it in order to protect themselves, their families, their loved ones, etc. Mm-hmm. Having said that, I'm also a big believer that we still have not taken on this issue of racial bias. And one of the things that I am fascinated by, and I don't know how you feel about it, and I don't want to hijack your questions, but it's so
I love you.
Is this Chat GPT. Did you hear about it? This new approach. And I don't know whether you've played with this, but it is a completely different kind of technology. And what it does is it predicts the next step. So what I mean by that is you can tell them, I'd like to have a poem written in the words of Shakespeare about COVID, and it will write a very good poem in that particular way. And it does it by taking a word and predicting the next word that Shakespeare might have used, and so on down the line. What's exciting to me about it is it's really the first time that computers have been able to think like doctors. How do doctors think? You tell me something. I have a pain in my shoulder, and I have a next question that I ask, which is what makes it worse? What makes it better? What happens if you raise your arm, pick up a weight? Because all those things will tell me information about it. I already have that prediction in my mind because that's how you train as a physician. This can do the same thing. Okay. Now let's look at racism. Now, why do I'm so excited about this? Because you have two patients who have the same operation. One is a white patient, one is a black patient. And what do we know? That doctors give 30% less pain medication to the black patient. Same operation. Well, this algorithm would predict how much pain medication do you give after that operation.
Regardless.
And when you deviate, it calls you out.
Oh my God.
And so I think the possibility exists. The problem with the old artificial intelligence is that it used the data that doctors did. So it built in the biases.
Okay, yes.
A black patient got less because the AI assumed the black patient had less pain sensation. Totally untrue, but that's how doctors behave. So the AI mimicked it. Here it goes the other way. It steps ahead to say, what would I give? Oh my gosh, you gave 30% less. What's going on? Who would I pick out of this group? Oh, you picked half as many people of color than I would have predicted. All of a sudden, you're looking at the possibility of this technology, this ChatGPT, being able to prevent errors, to prevent biases. It can predict what you should be doing. And when you deviate from what it thinks you should be doing, it can call you out upon it. And I think that's a potential way that we can build into medicine at every point of contact. Anyway, I just wanted to throw that out there because the last time we talked about AI negatively, and now we're ChatGPT that has an alternative. Sorry about that.
Oh, no. I love that you brought that up because I just said to somebody yesterday that we have so many civil rights issues that we could fight about, and we do, and we make laws and we do different things. But fundamentally, until we get in a room and speak about racism and really dismantle it and eradicate it, the other issues are derivatives and people are affected within the other issues. So if you're LGBTQIA, you just have, and a person of color, now you have two things that we can oppress you by. If you're, so it's not like, oh, let's go do this other work first. Let's do the whole pie so that we can move forward as a humanity. Even in uncaring, it's like you say, looking at the total picture. And this technology, I love the idea of that, holding somebody accountable, because we as human beings don't. I'm calling it, we don't. We can sit in a room, I've done it myself, and know that what I'm hearing, know that what is being contributed to is dead wrong, but because the opposition that I know that I will come up against when I say blah, 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 or that deadpan look that you get quiet, you get introverted, you get reserved, and you get tired of being the one fighting the fight. So I love this kind of thing because then it says to you, why? Why did you make that decision? And hopefully we can learn from this technology as humans and be more automatic in that way ourselves. Like, why did I make that decision? Why? I mean, and it's okay to ask why. I think that's a wonderful 3-letter word. Why?
So we're back to where we started with culture.
Yep.
So in any culture, the culture tries to keep peace because the way a tribe succeeds is by harmony. If everyone's battling everyone, no one collaborates and cooperates, then you don't have a group, you have individuals, and individuals are never as strong as a group. Amen. And that's why the mask issue that you raised earlier becomes an issue. It's cultural. And that's what you're describing. Yep. People either don't really say what they mean because they don't want to get resistance. It's not necessarily it's just culturally something you don't do, and you never therefore address the issue that is sitting there. And you particularly are going to be dealing with this if you're dealing with people in a room who are not all the same race or the same gender or the same sexual orientation. I mean, it doesn't matter what the group is going to be.
That's right.
So those are going to be the challenges that are there. And I think one of the powers, again, of this technology is it doesn't have any feelings to be hurt. It's going to raise the issues because it doesn't care what you think about it. It's just going to try to do it. Now, there are challenges because people can manipulate it in ways to get a lot of bad things to happen. The OpenAI, the company that creates it, has tried to build that in there. But, this is a threat. What I see is that when there is a new technology and the genie comes out of the bottle, you never get it back in. People talk about social media being terrible. It's not going away. Maybe we can do things to make it be positive rather than negative, but don't say, well, we're going to ban it or get rid of it. It's not going to happen in a democratic world. It could happen in a totalitarian society, but not in a democratic. The same thing I would say around these other cultural issues. How do we use them and overcome them, making it possible to do something that wasn't there before? And again, that's what I'm caring is about. How do we change the culture of medicine? To me, one of the things I'm focused on a lot these days is lifestyle medicine. When I look at lifestyle medicine, are the things you can do to take care of yourself: diet, exercise, mental relaxation, prevention of chronic diseases, everything that the patient can do that's part of their day-to-day life. And I think that we're not going to be able to address what I see as a crisis coming in healthcare, a tremendous cost crisis, as the cost of care is going to go up to the point no one can afford it, whether it's the businesses, the individuals, the government. And I think there's a solution that people are going to try to do, which is to shrink it down, take away benefits, do a lot of very things destructive. But the best way to do it, keep people healthy, avoid disease. That's how you lower cost from my perspective.
Yep. I don't know what era we were living in, but I remember when I guess I just graduated from college, so this would have been in the 70s. We were really talking about primary care, preventative care, because the whole idea was this. And then all of a sudden we shift into this thing, and now we're calling it managed care, but it sort of kind of is working, but sort of kind of not, because the cost of it is still not where people who are Medi-Cal eligible, they still can't get it. And Dr. Pearl, I was telling somebody the other day, I have two sets of medical advisors. So Kaiser, I've been using Kaiser since I moved to California. But then over the last 15, 20 years, I actually have a holistic doctor. He's Asian, and we do acupuncture, massage, and he makes me stuff for my gut because I have one of those guts that we're trying to make so that I can eat what I want, and I'm almost there, which I never thought was possible. All of those things, but I can afford to do that. And I've done the homework, like you're saying, to know where to go and how to ask and all of those things. But then you have a population of individuals who I serve that don't have the ability to do that and even don't understand the managed care system that they're a part of to even ask for those kinds of resources. And what you're saying, and I love, even in Uncaring, was let's build a system that has all of these multiple things. So we're not just always going to the most expensive part of us to figure out how to take care of another person. I mean, how far away are we from that? Are we teaching that in our medical schools? So in our medical administration, I mean, how far are we away from even being able to have the dialogue to make a little tiny baby step forward? So
before I do that, let me ask you a question.
Okay.
And I'll warn you in advance, you're going to get it wrong, but I think it's great because I want all the viewers and listeners to also ask themselves the answer to this question. All right. There are 330 million Americans, 30 million of whom are not insured. So there's 300 million insured Americans. All right. Of the 300 million insured Americans, how many of them are insured through Medicaid? Medicaid in California, it's called Medi-Cal, but it's Medicaid. How many of the 300 million people do you think get their insurance, their health insurance through Medicaid?
About maybe 1 million?
How about 100 million?
Oh my God.
100 million Americans. That's exactly right. We're not talking about a few poor people. We're talking about 1 in 3 Americans. Yeah, I just wrote for Forbes about this. Yeah. And you stick on top of that another 60 million through Medicare. You're talking about more than half of the American populace is insured through the government. But yeah, so now why do I say that and point out those numbers? Because that tells you how close we are to the crisis that's coming. Now, here's where I think we have, I'll say, 2 pathways. One pathway is that the changes that need to happen, that everyone knows should happen, will occur through the traditional healthcare route. Doctors, nurses, hospitals, all the places we normally go. I'm concerned that that's not going to happen. I'm concerned that the magnitude of the change that's needed isn't going to be led because those individuals are in a culture that says we're doing the best that we can. But I'll tell you where I think the change is going to come from. The retail giants. We're talking about Amazon, CVS, Walmart, Walgreens. And why do I say that? Because in the past 6 months alone, each of those large retail giants has purchased major providers of care, doctors of care. You had Amazon that bought One Medical that's, from San Francisco, but it's across the country. It's now part of Amazon. You have CVS that bought a company called Signify, which is 10,000 home health physicians. And they're now talking about buying what's called Oak Street, which is a major primary care, thousands of doctors. You have Walmart that just signed an agreement with United Health. You have Amazon that has PillPack, that's a pharmacy. If you think about what do you need to deliver the totality of healthcare, you need to have an insurance arm, you need to have physicians, you need to have pharmacy, and then you need to have the ability to contract with a small number of hospitals for what you can't take care of in your network. All of these giants are doing it and doing it fast. Now, the question is really going to be, these are companies, I would say, that are pretty consumer friendly. I mean, I use Amazon all the time. You go online, you order what you need, it's delivered on time, you got a choice of products. A lot of people shop at Walmart. It's a company that has a lot of broad selection with a good value for the price that you pay. These are not ones that take advantage of the consumer. And so if they're going to lead the way, I think that day is coming very soon. I think they're just about ready to do it because they recognize how much of healthcare today is inefficient. And if they can take out the inefficient parts, make it as simple as Amazon ordering from your home. Mm-hmm. But where's the warning sign for the people who are listening, maybe in healthcare? I'm not sure the Amazon workers are very happy.
There you go.
The customer is happy,
yes,
not the worker. And I think that is it's why I keep writing, because I want to encourage clinicians to lead the way, to embrace this technology. I'll give you an example. Think about Alexa or whoever's, whatever device you have in your home that reminds you things, tells you the weather, plays you music. Why are we not using that device to improve your health? To tell you when the time to take the medications. It's hard to remember when to take medications. Hard to remember if you took the medications. Yep. It can tell you exactly that. Yep. It reminds you to take your walk. Yep. It could talk to you about the food that you're getting, the preventive care that you need. It can do a lot of things. And if you are on a device, because you have diabetes, you have a glucometer, or you have heart failure, you need to have an electronic scale. It can connect with all of that. We have tools at our disposal that we're not using. And I think that if we had those tools, we could empower the patient. And that is who I think needs to be empowered. And it's why I think people inside medicine, they don't want to empower the patient. They want to keep the power inside the institutions. Yes. They want you to have to go to the doctor's office. They want you to use the hospital. They don't want you to have care at home. They don't want you to be able to have care virtually.
Oh, I know.
These other companies, I think, are going to break through and make it better. And so people, even the 100 million on Medicaid, would be able to get a level of care today that they can't get, and maybe get a level of care today that's even better than the people who have the best insurance, because it will be technologically enabled. It will be patient-oriented. I can't promise that it's coming soon because it's the future. But I think 10 years from now, I suspect it will be very different than it is currently.
And it's going to affect the way those of us that are aging in place. I know that here in California, one of the programs that we've implemented, or my organization has implemented, we're going out into the home and doing medication management. We're going out into the home when somebody can't come to the daycare center, just to make sure the caregiver's okay, the individual. So they're coming back a lot quicker into our system, the respite system and the medical system that we have, because we're connecting the home to the care service, and then now we're like family going into the home. So it's like they have their medications out on the table, they're ready for us, and then it creates trust, which also says, I also, need a little help with Meals on Wheels, or I need a little help with this. And so then you have this approach that is I can't remember who wrote the book, but the best friend approach, where, yes, I'm somebody that can help you, but I'm also your friend that is coming into the home and meeting you on a level playing field. I have been in awe of the results of that program. We started it because of the pandemic. Because we couldn't bring people in. Dr. Pearl, people are just amazing. When we have a caregiver who's just like, when we come in, she's got it down. She writes about his symptoms. She talks about what, and so she's engaged. And it's interesting, even though he's not able to come out of the home, her stress level is down because she's engaged in the care and she understands it. So she's not there fretting about all this stuff. So I agree. I mean, I think it needs to be this whole thing where we're all coming together. I'm amazed though when you recite the companies. Those are heavy hitters, and those are companies that do know how to deliver customer service. They may not be taking care of their employees, but Amazon is my best friend because I'm too busy to go into a store. So yeah.
Well, I love your story because I think we learned during COVID the pain and the problems of isolation and social distancing. Yeah. And what you're really talking about, because someone who's sick, they can't just go out to the store, go out to a restaurant, the fact that there's someone coming into their home. And what I'm talking to a large extent about is how do we give this caregiver more tools? Because we can augment those things. You mentioned a couple of very excellent programs, but how about if there were 10 other things that could happen that could connect this individual with other individuals with the same interest, the same problem, whatever it might be that is of desirability for each person, giving them tools to help them better understand their own nutrition or to keep track of their own disease. I mean, these kinds of empowerment, I think, could make a huge difference. The thing about being sick is that you have a lot of time. You don't have much time. We're busy working. You probably work 5 different jobs. So, but if you're sick, you have time. So How do we create tools that take what you have, which is time, and give you benefit out of that time? And that's, again, where I see technology, which eliminates time and distance. You want to have a friend in some other continent or country? Yeah, we can connect you guys.
Yep.
Figure out the time zones and put you together early in the morning here and late night there, whatever it's going to be. Yeah, how do we teach you a language? How do we do these things relatively inexpensively?
Yes.
And now you start to change. How do we have people, again, eat better, exercise better, focus on the opportunities to better manage the chronic diseases, prevent the ones that they don't, avoid complications of chronic disease. These are the opportunities I think that we just have not taken advantage of. And I'm not seeing it. I got to tell you the truth. I'm not seeing medicine embrace it. There are a lot of companies out there talking about it. Don't get me wrong. But I think that if you walked into the typical hospital today and you walked into one 20 years ago, they're not going to, the machines will look different. They're much more sophisticated now, but it's not going to be that much more different. And when I look at the question, over the past 20 years, life expectancy in the United States has gone up 0. We have exactly the same life expectancy now as 20 years ago. In the previous century, it went up an entire generation, 20, 25 years. This hasn't changed at all because I think where the big opportunities are going to be, and it's been proven, by the way, these are the social determinants of health. Where you live, socioeconomics, transportation, education, food. These are the things that actually have a 3 times greater impact on your health and your longevity than the specific health care that you receive. And we continue to pay very little attention to it. Some of it is because it seems that it's going to be so expensive. It's not. No. There are aspects that are. But we can use technology, I think, to make it universally available. And I'm going to be going a little on a limb, particularly to those individuals of color who might not have the opportunities that exist in other communities.
Yep.
How do we bring the opportunity into the community rather than expect the individual to have to travel to a different community?
Right. And one of the things that you just said made me realize that also teaching from the very beginning, when we are in the school systems and really helping our young people as they grow to understand the importance of meditation, the importance of being quiet, the importance of going for a walk, the importance of being in nature. When I started learning about all those things, my health got better, to the point where my high blood pressure even went away. And because I had to go to the doctor going, I don't know, I feel faint. And it was because my blood pressure had gone away and I was still taking the stupid pill. But again, it's because of listening to people like you, reading and being in the field. That's the other thing. I'm in the field of care and all of that. And I just want to say to all of you out there, Dr. Pearl has raised some incredible things. And I know that we can make a difference. Look at how we just changed the suicide hotline number from this 10-digit thing to 3 digits. This morning, I heard on NPR that they're serving more people. They went from 3 minutes to like 30-something seconds in getting people just by taking 10 numbers and making them 3. You see how powerful when we do something, instead of just saying, let's leave it the way it is because it's working, it's not completely broke. And now we're servicing and preventing people from taking their lives much more quickly. So I just think, Dr. Pearl, you have so much wisdom, and we definitely want to have you come back more than every 2 years, because when I read your stuff and because you are a physician, you can really help those of us who are advocates, excuse me, to totally understand how we can support our medical partners in really changing the paradigm of how we think about health, life, longevity, all of those things. And so I just really want to thank you, for being an advocate for people of color, because it was clear to me when I met you and when I've read your books that you truly get it. You may not have experienced certain things that I know I have or other people have, but you get it. And you took the time to listen and to be in spaces so that you can contribute to the hopefully solution that we all can contribute to in the future. So I just want to thank you for, because I know you also have to go out on a limb and be courageous, and speak things that are the truth that sometimes people don't want to hear.
Well, that means a lot to me, particularly coming from you, because you have a huge social network of folks, and your seal of satisfaction is wonderful. So if listeners want to get more information, they go to the website, robertpearlmd.com.
Yes.
A lot of material there.
And I told you before, this book is amazing. It's an amazing read. You can get through it, but it's also something that is helping Doctors Without Borders, which is another fantastic. They've been around for a really long time, and you've seen the commercials where they've flown in and done surgery in places where you wouldn't even go. So please, buy it, read it. Have a conversation. I have young people in my life. I have a 34-year-old son and a 24-year-old daughter. So they're very engaged in the world. So I'm always talking to them, Dr. Pearl, about life. And they're always exchanging things with me. One's a millennial, and the other is a Generation X, whatever, Z. And so they're different in many, many ways. And then I am a baby boomer. So we have to come together. All of us have to come together and begin to have these conversations and do it from a place of, I want to learn about you. I want to touch you, and not from a place of, just because I've done this for 25 years, I'm the best person in the whole wide world to tell you how to do it. So I want to ask you one last question before you go. How long is this cough going to last, since I had COVID back in September?
So there's a lot of data on it. The data says that it does get better, but it can take at least a year. I hate to say that.
Okay.
People are putting it into the context of what's called long COVID. Long COVID is sort of a large grab bag. Some of that is the brain fog, which clearly you don't have, which is great.
Thank you.
Some people have that. But the cough can last for a while. The only concern that I have is making sure that the cough is actually from the COVID, not from something else. Okay. So if you haven't checked in with a doctor at some point, or seen whether you need to have any type of X-ray or anything else to be sure, you might want to do that. But it's not uncommon, unfortunately, for symptoms to last many months, up to a year, and sometimes even longer. It's one of the great unknowns of medicine. Why does it happen? Why does it last? Who gets it? Still being researched literally every day in almost every journal. But hopefully it'll go away. But as I say, if it's still there, you might just check in to make sure that there's not something else that happened to come on at the same time. I mean, that's the hard part in medicine. What's causation? What's correlation? But most likely it will get better.
I'm looking forward to it. Dr. Pearl, you and I still need to get together for lunch, dinner, or coffee. We haven't done that yet. So we have a lot to look forward to in the future. But we also have to look forward to a future that together we're going to try to move this from uncaring to other way around. What? Wait.
There you go. To caring.
To caring.
Yeah, absolutely. Absolutely.
That's what it's all about. And one of my mantras for 2023 is it's all about love, and we have to give love to each other. And love does not always mean sexual love, people. Stop going there, because you go there and then you go, ugh. Love means respecting someone. Like, I love Dr. Pearl because I respect his work. I respect what he does. He comes and spends an hour with me and does that graciously. Be the love you want to see in the world, okay? Because without us doing it, it's not going to happen. We got to stop pointing finger at each other and waiting for somebody else to change the world, because it's not going to happen. We got to do it ourselves. And for all of you that are out there experiencing pain in your heart, pain in your soul, I always tell you, 988. You can text it, you can call it, you can email it. So just get some help. If you think that you're not worthy of help, that's a lie. Everybody's worthy of help. Somebody told you a lie, okay? So get the help you need. Have a great Martin Luther King weekend. Dr. Pearl is an amazing author, an amazing advocate for healthcare, and we're going to have him come back. So, Dr. Pearl, I just wish that you the best. Always, always. And I talk about you and lift you up in every space that I can get in that is a medical space where I see that people don't get it. I'm like, okay, so you need to talk to my friend. And since you can't call him, boom, read his book. So
I love your show and I love your spirit. So keep it up and we'll do this again sometime. Thanks for having me today.
All right. Thank you, Dr. Pearl. Have a great weekend. Everybody have a great weekend and take care of yourselves. Be well.